And welcome into To Your Health. And a lot of our audience is very, very interested in, would like to know everything they can possibly learn about Alzheimer's, dementia. We're all looking at friends and we're looking at ages where we're going to see a good bit of this. We are very fortunate to have with us today Dr. Will Rutland, who is the head of the psychiatric department and whole resident everything at the UAB Medical School in Montgomery. And we're gonna clear up some things for you. Sure. And teach you what to look for, what the difference is, and we'll just fill us in and educate us.
Sure. Well, I'm happy to do it, and thanks so much for having me on. I'm really grateful to be here, on behalf of the Montgomery campus of UAB Medical School, and of course, that's a place that's near and dear to all of our hearts, but having a branch of it here in Montgomery is just so critically important.
Amen.
And we love being a resource for our community here in Montgomery. Your question is well taken. Thinking about dementias, which in the medical jargon we call major neurocognitive disorders, is something that's at the forefront of everyone's mind. Here in the United States and most of the developed world, we're all living longer, which is awesome. We love that. But that means that we run into some of the issues that can happen as your age progresses into the late 70s, 80s, and beyond. And one of those, of course, is dementias. You mentioned Alzheimer's in particular. And so Alzheimer's is the most common major neurocognitive disorder. That is to say, it's the most common dementia. And so that's the one that most people are going to be familiar with. And so some things to look out for maybe in regard to Alzheimer's specifically. The early indications are going to be loss of near-term or short-term memory, but preservation of long-term memory. And this can be a little bit of a confounding thing to see, because folks will say, gosh, I feel like I'm losing my memory, but I can tell you exactly what I was wearing the day that I graduated from high school, and so I must be okay.
That's right.
And, in many instances, you are okay. The sort of early stages of Alzheimer's can be negotiated around. There are things that we can do to help. There are even some medications that can be useful. But as Alzheimer's progresses, of course, you'll get larger deficits in memory, and that can lead to limitations in your functional status. You can't sort of remember what you're doing, and it makes it harder to navigate the world. And so what we hope to do with anybody is to catch the disease progression early and then start some of those interventions. And for Alzheimer's, really the best interventions are a combination of behavioral and medication.
Okay.
So maybe I'll talk a little bit about both.
Good.
Would that be all right?
Oh, yeah,
yes.
great.
All right. So really, behavioral things are the most exciting because they are things that we are maybe naturally drawn to do or can be helpful to us in multiple ways. For instance, one of the best behavioral interventions is simple socialization. Go out there and talk to people, go to church, go to your civic groups, go to family reunions, hang out at your favorite coffee shop. Do anything you can to increase your interaction with others. That keeps our brain active and can have some really positive benefits in major neurocognitive disorders, including Alzheimer's. And so get out there and do things. Now, taking care of your overall health is also very useful. So things like eating a good balanced diet, making sure you're getting all your nutrients in, being active. You don't have to run a marathon. Don't expect anybody out there, qualifying for the Boston Marathon. You don't need to do that. But, walk around, get your heart rate up a little bit. I often tell patients to start by being the person in their household who checks the mail. So walk to the curb and check the mail and back. And you're the person that does that every day until you start to feel comfortable walking. Once you get to once you become comfortable doing that, start walking to the end of the block, or maybe even around the block. But getting in, at least 30 minutes of some light activity every day is incredibly helpful in preserving your overall health, which in turn serves your neurological health as well. Okay. And so those are kind of interventional things that you can do. Find joy where you can, participate in activities you love. If you're someone who likes being out in the sunshine, get early morning sunshine as it happens. That really helps your sleep-wake cycle. So early morning sunshine starts the clock on when your body is going to go to bed. So if you're having trouble sleeping, go out, spend some time, drink your cup of coffee in the morning in the sunshine. All of those things, little things, can really help preserve your cognitive function. So that's kind of the behavioral part. And then medication. So medication is exciting these days. We have some tried and true medications that we have been using for a long time. And then we have some new things that we're starting to learn about. And maybe I'll touch on both of those. Kind of older school interventions that you've heard about are a group of meds called the acetylcholine esterase inhibitors, or ACHEIs, or a different kind of medication called memantine. The brand name is Namenda. I am not shilling for anybody on this. Right. But in any event, those are medications we've had for a while. And really the goal in those medications is to kind of preserve function. So it doesn't turn back the clock on Alzheimer's, but it sort of stops the progression of the disease where it is. That's what we're shooting for.
That's encouraging. Now, what we're going to do is we're going to stop this right now, and then we are going to bring you back.
Okay.
And we're going to follow up on this next week.
Ooh, I love that.
Give you more information. Thank you so much for taking the time to be with us.
Happy to do it. Thanks so much for having me.
And stay with us. We'll be right back.